Long term, there can be twinges of pain within the breast that occur primarily from surgery, but radiation also exacerbates that somewhat. There can be tightening of the skin, as you said, or changes to the skin. There's a potential increased risk of lymphedema or swelling of the breast and swelling of the arms. There can be, rib fractures. There's a study showing that there may be up to a 3% increase in lifetime risk of rib fracture on the side that's treated versus the side that's not. And those are most of the things. Patients that have bilateral mastectomy and have expander placement, those patients can have up to a 40% risk of changes in their the texture of the expanders and the skin. They can have the expanders have more fibrosis and develop fibrotic capsules around the expanders or implants. These are all, potential side effects. I would say the most common things that my patients experience are erythema of the skin, potential peeling of the skin, fatigue, and twinges of pain within the breast during treatment. Radiation for the breast, also does treat part of the lungs. You can develop something called radiation pneumonitis, or an inflammation of the lungs that usually gets better with steroids for a brief amount of time. And so those are kind of the rundown of early and late side effects of radiation. The other thing I also have to talk about is radiation causes cancer. So how do people wrap their head around that? So most of the studies that talk about secondary malignancies in radiation are done in the pediatric population, and the risk of secondary malignancies are about 1 in 1,000 over 20 years. So there is a small potential risk, but there's also typically a 50% decreased risk of local recurrence, which we feel far outweighs the potential risk of secondary malignancy in this setting.